An abdominal aortic aneurysm assessment by the aorca with an aneurysm living in the abdomen of an assess man, but finding a way to burst out of there. Abdominal aortic aneurysm. Imagine abdominal aortic aneurysm assessment by the aorca with an aneurysm living in the abdomen of an assess man, but finding a way to burst out of there. Abdominal aortic aneurysm occurs due to atherosclerosis, shown by the clogged artery guy. While patients may be asymptomatic, assessment findings may include the presence of a bruit, shown by the bruit. They may complain of a pulsation in the abdomen, shown by the pulsating abdomen, and experience abdominal or lower back pain, illustrated as the abdominal and lower back pain bolts. This pain is often described as a tearing pain, the tearing pain bolts. Quick diagnosis and screening is done via ultrasound, shown literally by the ultrasound machine. If a more specific size is needed, a CT or MRI scan can be completed. It is also important to note the possibility of the aneurysm rupturing, shown by the aorta rupturing. This can lead to hypovolemic or cardiogenic shock, depicted as the electric shock, thanks to the surgeon, who represents the need for surgical repair in patients with larger aneurysms or those with an increased risk for rupture. So let's review. Abdominal aortic aneurysm is caused by atherosclerosis, and assessment findings include the presence of a bruit, pulsation in the abdomen, and abdominal or lower back pain that is described as tearing pain. An ultrasound is used for diagnosis and screening, and it's important to be aware of the possibility of rupture, which can lead to shock. A surgical repair may be necessary.
Assess man is not feeling too well. There's a rumbling in his tummy like there's an aorta with an aneurysm in his abdomen. He and his buddy, clogged artery guy, were just enjoying a couple of brews when the aorta was awoken by the sound of a crumpling can. With his pulsating like sonar, the orca was able to confirm that there was indeed a brew nearby. He begins to get excited because everyone knows whales love brew and starts to desperately escape, causing abdominal and lower back pain bolts for the assess man. With his little red fins, Orca tears his way out. Assess man sees this and knows something is wrong. He uses an ultrasound machine and sees that there is indeed an alien-like life form growing within his belly. But before he could do anything about it, the orca ruptured out of his abdomen. Luckily, the orca didn't make it that far, as he was shocked by our hero, the surgeon. The assess man then pondered, "I've heard of living in the belly of the whale, but a whale living in my belly? Come on!